You've spent decades building a life, a home, and a family. But what happens when a sudden phone call or medical diagnosis threatens to take that away?
Welcome to Graceful Aging by Design. I'm Corina Stainsby, and I'm here with Frank Fu. So, the last few years we've been serving the community through real estate, and we have sat at many kitchen tables and seen the heartbreak and the confusion that seniors and their families can face, especially when they have challenges that they weren't prepared for. So whether it's losing their independence or getting lost in the complex healthcare system, then we'd like to be able to provide the resources and knowledge for them to be able to help themselves and help their families as well.
That motivates us to create this channel and platform. We realize that designing your golden years isn't just about where you live. It's about having the tools that should navigate the unexpected with dignity.
And that's exactly why, for our first session here on empowering patients, helping them navigate through our healthcare system, we've invited Connie Jorsvik. Thank you so much for coming.
It's a pleasure to be here.
So Connie is the founder of Patient Pathways, and for the last 15 years, she actually has been helping her clients navigate through, I guess, the maze of hospital decisions and discharges and all kinds of things that patients have to face, especially when they have a critical illness.
Right.
So, Connie, are you able to tell us a little bit about what you do and what Patient Pathways is all about?
First of all, thank you so much for having
You're welcome.
me here today. I really appreciate that. So I was a nurse for 25 years, 15 of that in cardiac critical care. And I was always an advocate for my patients, first and foremost. And then a little light bulb went off a little bit more than 15 years ago, and I realized that there needed to be somebody who was helping not only patients navigate our healthcare system, but the often neglected families in our healthcare system. They're the ones who are supporting the clients or their loved ones through this, and the healthcare system kind of leaves them behind. So I now have a fairly robust team.
Great.
And we help people in all aspects of the healthcare system. But for me, it's all about serious illness, complex illness, and end of life, and helping them with that. And I would say that the biggest challenge is often sudden illness,
Right.
where people are not expecting it.
Yeah. I come from that experience. So I think for a lot of families, a lot of us, even understanding the healthcare system and how and navigating through it, how complex it can be, is something that we're not really taught, or no one really talks about it.
Nobody wants to even think about it. They might have had a loved one who ended up in emergency, or a friend, or they went to visit somebody in hospital. But somehow we don't personalize that could happen to us.
Yes, exactly.
I think it's a defense mechanism, but unfortunately it doesn't work very well.
No.
So that when we have vague understandings of going to the emergency room, we have a vague understanding of going to long-term care and what that might look like, but we don't really have any specifics.
No. So maybe let's just take a step back and just maybe talk a little bit about our healthcare system and how it's structured, so people can understand what they can do moving forward.
Our healthcare system, what most of us don't realize is that in Canada, it is built around the federal government has a very defined but very narrow role. Most of it is provincial. So the federal government is in charge of the Canada Health Act. And one thing that I haven't written about, but that's really important, is also around medical assistance in dying, is federal, because it's covered under the criminal code.
Oh.
And so there are very specific things. They provide our provincial governments with about 60 to 70% of the income for, or money for our healthcare system, but what most of us don't realize is that that only covers doctors and hospital care. It doesn't include anything that's happening in the community. That comes from general revenue. And so we're doing a lot of things where the hospitals are downloading a lot to the community, and the community healthcare system is under a tremendous amount of stress because they're seeing general revenues. So if we have a really big forest fire year, for example, that comes out of general revenues, and so does home care. So that's why there's a lot of stress that people might not know about.
Right. Okay. Well, that's good to know. I actually, didn't know that. So,
Yeah.
and so what do you feel is the most important thing when someone is having to navigate through our healthcare system? Say someone got a stroke or needs, heart surgery. What do they need to know?
There are a lot of pieces to that.
Yes.
And my book is available online. We've sold out 1,500 copies.
This is your book here,
This is
Navigating
my
the
book,
BC
Navigating
healthcare
the
system.
BC
Okay.
healthcare system. And so I've put together all of the pieces in a resource kind of thing so you understand every little piece. And it's available online still.
Wonderful, wonderful.
So, but everything is available to you online if you've got the time. The problem is that when we're in the middle of a crisis,
Yes.
it's hard to take the time to go to and do a Google search and find out all those pieces. And so we're relying on our healthcare teams to give us information, and that is very scattered as well.
What do you mean healthcare teams? Can you define
So
that?
nurses,
Okay, I see.
social workers, occupational therapists. People rely very heavily on their doctors, and doctors don't really understand the whole healthcare system.
Interesting. Interesting. They can certainly figure out what's wrong, but then send you along the path through our healthcare system. But then now it feels like you're on your own trying to figure it out.
Right.
Like, so what is the first step? So you've got a diagnosis, or if you need to go to hospital, then what?
Well, I would say to jump on the Patient Pathways website.
Okay.
And so we've got about 50 different articles laid out in chapters so that navigating the BC healthcare system is number one on the list. And it will talk about discharge planning, what to do when you're in the hospital, long-term care, what does that look like, home care. One of the big problems is that a lot of people, when they're in crisis, nobody expects to go to the emergency room, but one day you have a fall, you've broken your hip. You weren't planning on that, and then it turns the family into crisis. And then the hospital is trying to get somebody home. There's a hospital or a home first policy that the government has.
Yeah, okay.
So
Explain
that
a little bit about what does that mean?
Home first means that the hospital system must, and the home care system must try to send that person home before they can go to long-term care. And so a lot of time that's very stressful for a family. They've just had somebody who's broken their hip. They might have been dealing with dementia for a while, and now it kicks the dementia up to the next level. And so that is a really big crisis point when you've got an 85-year-old man and his 83-year-old wife, and he's 6'2" and she's 5'0", and he's falling all the time, and he keeps on ending up going back into hospital. So that, to me, is the center of where everything starts to go wrong.
So I guess, like it was based on what you mentioned, I guess the planning what will include the family members, correct?
Yes. Yeah, people need to build a team if humanly possible. And this is something that we need to think of way in advance. As we get older, we tend to start losing our friends, to lose our family to death, or our children move away. And it needs to be a very intentional team building a long time before we need it.
Right.
So becoming active members in a senior center or a church or wherever where we can come together and support each other long before we need it.
Yeah.
But when we are going to the hospital, or we're coming home, or say we've gotten a cancer diagnosis, what are the things that we need to put into place? There is limited transportation available for people, so who can help you drive back and forth to appointments, who can attend appointments with you. And that's where people like me and my team start to come in, because there are a lot of people who don't have anybody.
Right. Exactly.
So let's say if I'm aging and I'm worried for my future, let's say if I get dementia or some people need to take care of me and based on my wishes, what's the method or what's the process I can take to ensure that my wish is granted based on my intention?
First of all, we need to know what our intentions are, and we need to know what's important. And it's one thing that we really have trouble, and I think it's from a deeply unconscious or subconscious place that we don't want to talk about it. We might say vague things like, I don't ever want to get like that, I would never want heroics, but we have no really big understanding of what that means. Do I want my heart restarted if it stops? Would I want to go to an intensive care unit? Would I want to be on a ventilator? Those are a lot of questions that most people have no concept of. No. And then the crisis happens again, when families are put in a place where they say, are you sure your dad never said anything about this?
Right.
So the number one thing is to have a conversation with the people we love.
Yeah.
So my father said to me many, many times over the last decade of his life, if I ever get like that, I want you to shoot me or put a pillow over my head. And that is often something that people say, as light and, like, ha ha. But if somebody's bringing that up to you, take that as an opportunity to say, if I knew then what I know now, I would have pulled him aside away from my mother, who is his cheerleader, and had that conversation. That I'll never be able to do that, Dad, but we can put concrete steps in place so that if you ever get like that, when do you want me to stop feeding you? When would you want antibiotics stopped? Would you want to go to critical care? Which he would say, absolutely not. So it's those kinds of things that we need to think about. When I have dementia, because that's the number one thing that comes up. People are not too worried about cancer and dying of cancer, and that's totally appropriate. We've got systems in place for that.
Yes.
We don't have systems in place for dementia. And so we go and visit a loved one who's staring at a wall in a long-term care facility, and we don't want that for ourselves. But how do we not get there? And so it takes intentional conversations about how we maybe have an exit strategy of some sort, so that the healthcare system doesn't just keep on rolling.
I see. So is there where like a power of attorney and the representation agreement comes in? Can you talk about more about that?
Okay. So there are very important documents. They're kind of ignored by the acute healthcare system, but are absolutely essential when somebody goes to long-term care. And so number one is an enduring power of attorney. Okay. It is the financial and legal document that needs to be in place. Even if you are a couple who have joint bank accounts, you must have that power of attorney in place in order for your loved one to pay for your care.
Right.
And we often don't think about that until capability is already in question. And then it is too late to put that power of attorney. And then you might need to have a committeeship put in place. And that is a very expensive, very difficult time-wise. It can take several months to put a comiteeship in place.
So everything then is delayed or
Yes.
paused, right?
Right.
So there is a difference between power of attorney and enduring power of attorney.
Yep. And so power of attorney is usually put in place just for a specific period of time or for a specific event. You're going out of town and your spouse or your children might be trying to sell your home. And I'm
Right.
sure that that's something that you two bring up as well is,
Right.
if we need to make financial decisions during a period of time. An enduring power of attorney doesn't say that at the top of the document, but somewhere in the document it says this document is in place while I am capable and incapable.
Right.
And so it is a continuum of care. The one piece that I want to be really clear about is that you need to go to your bank with your enduring power of attorney while you're still capable with the person who is named, because the banks often have their own policies and procedures, and it can take a while. So if you're stepping in at the last minute or your loved one is already in care, it can take a month or more for that to be made active. And then your loved one is sitting in the hospital, can't be transferred to a long-term care facility
Right.
until that kind of thing is put in place.
Because the long-term care homes require an enduring power of attorney, do they
Right.
not?
Yeah, they do.
So really important to have. It's
Really.
just very practical advice too,
Yeah.
is going to the bank.
Yeah.
So most people have understanding about power of attorney or indirect power of attorney. How about the representation agreement?
Most people have no clue
No.
about a representation agreement, and it's an incredibly important document. So in other provinces, it's called an enduring power of attorney for personal and health, which makes sense. And but our representation agreement is more powerful than the other provinces, and it gives people a lot more say in their loved one or their friend's care. A representation agreement allows you to name anybody to be your health and personal representative.
Okay.
It doesn't have to be a loved one. It can be a neighbor or a friend. And that person can assist you while you are still capable, because none of us want to make the big decisions or be standing at the nursing station while we're sick.
Right.
But they can act as you when you are ill or incapable. So it's a very, very important document that most of us don't understand. And I still, all the time, I will be talking to somebody who's a director of care or a nurse in a long-term care facility, and they will say, well, you're his power of attorney. And I'll say, but that doesn't give me the right to say anything about his medical condition. That's where I need the representation agreement. And there's a lack of understanding, even in the healthcare system.
Okay, so that is really important. But why would someone not pick their spouse or their son or daughter
That's a
to
really
be
good.
on the representation agreement?
That's a really good point. And so when we're aging, often our spouse is going down the same medical and cognitive journey that we are.
Yes.
And I have counseled many people who just assume that their spouse is, and then I have a conversation and I can see that their spouse is really struggling to be able to make those kinds of decisions. Executive function is a really big problem with cognitive decline. And a lot of husbands, I'm being maybe a little bit sexist here, but they don't want to be that person. They don't want to be that person who's making the decisions.
What's an example of a decision that?
So actually in my parents' position, it was the opposite. But my dad was the classic long time roller coaster into ill health, and they lived in Kelowna. I lived here in Vancouver, and my mom would phone and say, "I've had to send your dad to the hospital. Can you come?" She wanted to be his caregiver.
Right.
She wanted to shave him, wash his back, bring him a good meal, but she didn't want to be the person who was talking to the doctors and the nurses. It was too
Right.
overwhelming for her.
Right.
So the representative is largely a hub of information. They are receiving information from the healthcare system, diffusing it to friends and families. And so often a friend is a really good choice. Families can live far away.
Right.
And so the representative, stands at the nursing station, makes the phone calls to the specialists, and then diffuses that information to the family.
Okay. Right.
So is there any example that say when the patient come into the hospital without the representation agreement, is there any procedure or policy if they first will assume like the spouse or the siblings or and then if they are not around, what's the hospital's policy or the procedure to help the patient make the decision they are now willing to make?
That's a team decision, and so that's a big role of the representative. What I find, and as I mentioned a couple of minutes ago, was that the healthcare system doesn't really understand representation agreements, not the acute healthcare system. So I do a lot of teaching when I go in and I say, "Hi, I am Ed's representative, and here's his representation agreement that allows me to make decisions for him, and to gather information." And so I do a lot of teaching up front. When families are going in and they say, "Hi, I'm the representative," and the healthcare team, the doctors and the nurses don't understand what the document is, then I ask for the social worker. All social workers are trained in advanced care planning. And so, but I also find that I put the representation agreement on the file, they make me the number one contact, and nobody ever looks at the representation agreement again. So it needs to be there.
Yeah.
But it's kind of like your driver's license in your wallet. Everybody assumes that you've
That's
got
right.
it, that you can
Okay.
drive the car.
Right.
And so people assume that you
Okay.
know what you're doing when you're the representative.
What if there is none? Then does it just fall to the spouse? Is that the next in line, or
Yeah, there's
the
a temporary
daughter, son?
substitute decision maker that probably applies to 98% of people.
Okay.
But it doesn't give them a lot of power. And it starts with the spouse, then it's the adult children, then I think it's siblings, then it's grandparents and various things. Get
Right.
down to number 8 before you get to close personal friend, which might be the best person to speak for you.
Right. Yeah.
I know that my friends actually know more about my health than my children do.
Right.
And so if you want your close personal friend to be your representative, then you must take the step
Okay.
of them being representative.
Right. And you need to go to a notary or a lawyer to draw up all
No,
these?
no, you don't. You can do it online through nidus.ca.
Okay.
And they've got an online form that takes about 5 minutes to fill out. And you need to have 2 witnesses who are not beneficiaries to your estate. They sign it, and it is now a legal document.
Okay.
Free.
That's great.
Oh,
Yeah, that's
nice,
Good,
nice.
good research to know too.
So for our friends over there, if there's one things you can recommend to start right away, what will you recommend?
Number 1 is talk to your families and friends. Just even the vaguest things, like my father saying that, that he would want a pillow over his head is enough of a clue so that when I was faced with that situation, when he was staring at walls and he was no longer, the lights were on, but nobody was home, thought to myself, what do I do now? And I went and talked to his doctor. And I said, he did not want to live like this. That's all he'd given me was a clue that this is not how he wanted it. And so we were able to discuss, and the doctor said, well, why don't we stop the antibiotics? And so he died several days later because the antibiotics were stopped. So even the little tiniest clues, I never want to get like that, gives the family a sense of he doesn't or she doesn't ever want to be in this position.
Right.
So just start with the basics. If you can know more about feeding, spoon feeding, about what heroics mean, dialysis, those kinds of things, CPR, all the better. But at least start with the basics. Then do your power of attorney and your representation agreement at the same time.
Okay.
And then if you have the ability to write an advance directive, then please go ahead and write an advance directive, or even on a piece of paper and just sign your name. I would never want to be in a long-term care facility and having somebody feed me. Mm-hmm. If that's something that's really important, just write it down, and at least your family can show it to the doctor.
Right.
And say,
yeah,
I know that. So I'm going to give you a story. So one of my clients was going for a transaortic valve insertion where they didn't have to open up his chest. He had no quality of life without this because he had a completely failed heart valve. But he was so sick and he was so frail that the doctor said, you have a 50-50 chance. He said, either you're going to walk out of here tomorrow or you're not. And so we wrote down, sitting in the cafeteria on a piece of paper, if I cannot walk out of this hospital on my own steam, if I can't go out in my garden, if I can't hold my grandchildren on my lap, I don't want to live. And he didn't do well from the surgery, and his family were able to hold on to those 3 lines as they were making decisions over the next couple of days. Yeah. And when it was clear that he would never walk out of the hospital, then they decided to pull the plug. Yeah. And he died on his own about an hour before they had to do that. But it was just those three little sentences was all they needed. And it reduced their guilt, and it reduced the complexity of their decisions.
So it's really all about helping yourself and the whole family know what your wishes are, right? When you are in critical illness or something happens. Right. So I just thought of something. What are the documents that people say you're supposed to put on your fridge? Is that the representation agreement? And
yeah. So there are. What does the hospital need to know about me right now? Yeah. If you have decided that you don't want to have cardiopulmonary resuscitation, that needs to go at the very top of your package. Then your representation agreement, your advance directive. Don't send your power of attorney to the hospital. It is a financial document. The hospital should have nothing to do with it. Right. But you can tell your people where they can find it.
Right.
I've seen people put in really strange places. Lawyers love to hold on to these documents. And so, but they're useless at 2 o'clock in the morning on a Sunday. So it's really important that copies be put into some kind of clear envelope and the fridge is the universal location for these documents. And if it's not going to be on the fridge, because most of the time our fridges can't hold magnets anymore, then put a clear note on your fridge. I've got mine on a yellow sticky note that they can be found in the back of my front door. Okay. Or above the fridge or in the freezer or the top drawer of the desk, someplace that the paramedics are going to easily look. At this point in our healthcare system, we must be responsible for getting these documents to the healthcare system and making sure that they are seen and acted upon. So I've got one client who is a frequent flyer at Vancouver General, and his daughter says, I'm sending him into the hospital, and I say, make sure he's got the documents. And I get there, and they're still sitting on his lap. So it is my job to then go and find his nurse and say, these are very important documents, you need to read them. And make sure that, I just act like a nurse and I say, I'm handing over this information and this is really important.
No. And the one thing maybe I can add is the medicines the patient already taken. Because sometimes I know some people are allergic for certain antibiotics, and the family may not have an idea. So you have to keep that on the fridge as well for paramedics to see.
I highly recommend it. There's a medical summary of things like who do you contact, what are your allergies, what are your current medical conditions, and what are your medications. Yes, very, very important.
Yeah, I think that's very crucial for us to have those information, and we'll put that into the resources so people can understand which is the steps and the documents we should put on the fridge.
Marvelous.
Yeah. So thank you so much, Connie. And today we wrap up with certain topics we have, and thank you so much to explain to us about our general healthcare systems and how do we empower ourselves, and also explain to us the information we need to protect ourselves and our loved one.
Thank you.
And all the information that you talked about is in your website, in your book, and we'll have you back to answer more questions next time. There's just so much to talk about.
Thank you
so much for coming.
Thank you so much.
Thank you so much, Connie.
Thank you so much. I really appreciate being here.
Thanks so much.
A huge thank you to our guest, Connie Jorsvik, founder of Patient Pathways, for her expertise as a senior healthcare navigator and patient advocate. Here are your design insights. Remember, BC's healthcare is a shared responsibility. While the federal government covers basic hospital and physician care, we rely on our provincial tax revenues to fund essential services like pharmacare, home care, assisted living, and other community care and services for seniors. Planning for the what-ifs isn't easy, but having a design in place protects you and your loved ones. Here is your action plan. Step 1. Define your intentions. Research emergency and end-of-life care and decide what you want and who do you trust to speak for you. Step 2. Start the conversation. Share your wishes with family or a trusted friend who understand your medical needs. Step 3. Put it on paper. Visit a lawyer or notary to set up the enduring power of attorney for future financial decisions. And also, set up your representation agreement at the same time, either with your legal team or do it free on your own at nidus.ca. Pro tip, remember to visit your bank as well. They have their own policies and procedures usually. Finally, prepare an emergency package. Keep your medical history, medications, and emergency contacts in a spot where paramedics can find them instantly. Do you have any topic suggestions or questions? Reach out in the comments or email us at gracefulagingbydesign@gmail.com. If you found this helpful, like and subscribe so you don't miss any future episodes. It'll also help us reach more families who need these resources. Thank you, and we'll see you in the next episode.